This is Dr. Nabajit Talukdar. I am an interventional cardiologist and electrophysiologist at Batra Hospital, New Delhi. Well, these are the days of COVID. The world is changing. The way we practice medicine, the ways of medicine, economics, social, political, everything is changing. Now COVID has taken the world by storm. Instead of telling all the mundane details, I will try to talk something which is very relevant. The mean age of population in India is around 30 to 40 years. So the Indian population is elderly. So these population dynamics is one part. Apart from this, there are three strains of virus, A, B, and C. So these virus, over a period of time, has, of course, undergone some amount of mutation or change in their profile. So that has also to be uh, borne into mind. So when we talk COVID, it is an vast interplay of different factors, especially the patient factors, host factors, and environmental factors, the famed epidemiological triad, as we say. Now, COVID has got good interaction with presence and absence of other comorbidity. India being one of the nations of the world where diabetes is rampant. So presence of diabetes, how does it affect COVID? That was another question. So patients with diabetes, if they are having COVID, they need to be more cautious, because in the presence of diabetes and other diseases which afflicts the immune system to be causing them to be uh, more weakened, those diseases affects the effects of those diseases are more. So what happens in diabetes? Diabetic patients are subjected to tissue stresses and tissue strains, both in oxygen derived free radicals, the direct glycemic hyperglycemic effects, also the effects of other vascular factors as well as the drugs. Now this lays a fertile ground for the rampant manifestations of COVID. Diabetic patients with COVID, what they should do? Whether they are doomed? Answer is no. If diabetes is well controlled, then COVID will have the same course as it would have in a normal population. So the diabetic patients need to think or need to see that their medicine adherence has to be regular. They have to take the usual, normal, regular medicines until and unless they are in ventilator or in critical care conditions. Then only the question of insulin or other things comes. But otherwise, they has to continue the same medicines and with the same vigor and with the same effort what they're doing. The diabetic patients also needs to be careful about their personal hygiene. Their hypertension and other factors also needs to be checked. They have to, just in usual condition, self monitoring of blood glucose, regular checks of urine, regular are to be taken into account. Having said this, the influence of diet cannot be taken away with. The diabetic patients, they have to follow the same healthy kind of diet, avoiding high glycemic load, going higher on proteins and other beneficial fats is more important. If they're taking statins, they have continued taking statins. If they're taking antiplatelets, they continue taking antiplatelets. Diabetes, three of them are in AC inhibitors or ARBs. If the patients are already on AC inhibitor ARBs, the current recommendation, even in the presence of COVID, they are not to discontinue it. They have to be in touch with their normal physicians, and then they have to do it. Now outdoor activities are limited, so diabetic patients might have difficulties in having the outdoor activities. So they are now requested that they stay at home and do aerobic exercises, which is quite possible at home, uh, expending their calories and keeping their body fit. The eye care, the skin care, foot care, and other cares of diabetes needs to be maintained as the message is, however, the diabetics are not doomed. If you control the diabetes well, if you control the diabetic situations well, COVID patients with diabetes, with the presence of other statistically there are higher risk of complications. That is things to be aware of and take steps as it comes. Thank you.